Hello, over the last several days, we've talked about several reasons why you could have pain to the ball of your foot. We've gone everything from Morton's neuroma to sesamoiditis to metatarsalgia and predislocation syndrome. Today, we want to talk about the final one that we'll be talking about in these discussions, which is turf toe. Now, if you look at your foot here, you've got all the different joints of the toes. Turf toe usually happens to the big toe right at the first metatarsal phalangeal joint area, so right in this area. And usually what happens, it's forced dorsiflexion of the foot where you actually tear the ligaments. There's ligaments that go right around the joint that their job is to hold that joint together and hold that foot in place. And if you tear those ligaments, that toe can dislocate or can move in a way that gets really quite painful. This is usually a problem on turf fields in a football game, for example, and that's where that turf toe information comes from. That being said, I'm seeing it for multiple reasons. I'm seeing it in football players, of course. I'm seeing it in soccer players. The most common reason in a soccer player is they kick the ball at the same time and it forces that toe up. They do the same tear. So when they hit that, one toe's pushed up, it tears those ligaments, and they actually get that injury and that problem in that case. So either way, they hurt in that whole joint. They hurt around that whole area, and they actually get pretty significant pain, and it hurts to even walk, especially if that toe needs to move up in any sort of way. So you'll get pretty significant symptoms. It's usually right at the base of the big toe. It's usually anytime you're walking. If they're sitting, they may have some throbbing, but they don't have as much discomfort. And usually they have a point where they were injured. They have a time when they actually felt an injury to that area. And so that's kind of what they're talking about. So basically, the symptoms will be right in that joint, so right at the base of the toe, and can be pretty significant and be pretty limiting. So if you have those symptoms and you're evaluated, the first thing that needs to be done, of course, is get an x-ray to evaluate if there is any fracture or additional injury. We start worrying about fractures of the sesamoids. We start worrying about fracture of the first metatarsal or to the base of the proximal phalanx, for example, of the great toe. So those x-rays are very important to evaluate the injury and to see the severity of the injury. If you have some fractures, some of the treatments that can be done for turf toe cannot be done for fractures. If you have pretty significant discomfort, there are things you can do just to decrease the pain, decrease the discomfort, but they don't fix the problem. One of those that is sometimes done is a cortisone shot to the area. The disadvantage of the cortisone shot is it literally does not fix the problem, and it may slow down the healing of those ligaments, but it does alleviate the pain. You can do a laser to the area as a laser to any other ligament. We found that the MLS laser will actually improve the healing of those ligaments and repair it. Although I do recommend, even if you're going to do the laser, that you do something to protect those ligaments in the normal process of your daily living, normal walking. So the most common treatment that I will do is I will teach an individual, both by showing them how and then by doing it myself, how to tape that toe. And the taping, actually, you end up taping right down the center of the toe, one to the side, and then you have straps that go around the toe to actually hold that toe in place. The whole point is what you're trying to do is limit that motion so you can't get any dorsiflexion of the toe. In a really severe injury where you dorsiflex and plantar flex, it's a similar type symptom, but we end up taping on top and bottom to completely limit the motion of the toe. In some football players, they'll actually do a carbon fiber plate in the shoe that, again, limits that motion to allow them to still push off without having the associated pain from the forced dorsiflexion of the great toe. In all cases, the goal is, one, to decrease the motion and give it time to heal, and then to give it the 4 to 6 weeks it takes for the ligaments to heal in good position. Taping works really well in most individuals. If you have a high activity level like a football player, you may need to do something more rigid to protect it even more. So this is turf toe. It's a very common problem. We see it quite often. It can be easily treated and does not necessitate most of the time that you not participate in your sports or your activities. So this is Dr. Brandt Gibson. This is your podiatry tip, day 17, turf toe. Now, tomorrow we're going to start talking about some of the more common problems that we do surgeries for, like bunions, Taylor's bunions, hammer toes, and some of those kind of things. And so we'll move along in that direction. So have a great